Statin drug side effects. What are they, and what are the other things that you should be equally concerned about concerning a statin drug? Coming right up. Hey, I'm Dr. Ekberg with Wellness for Life, and if you'd like to truly master health by understanding how the body really works, make sure that you subscribe and hit that notification bell so that you don't miss anything. So we're going to talk about statin drug side effects, and this is a request from Walter the musician. So I recently did a long video on cholesterol and we covered a little bit, but I wanted to expand on some of the mechanisms of the side effects and talk about why we really need to understand how all this works. So here are some of the most commonly recognized side effects. Things like liver damage and muscle damage, and of course your primary muscle is the heart. There is problems with memory, concentration, and depression. Cholesterol is very important for the brain. There is pain and peripheral neuropathy. There are sleep problems, sexual dysfunction, and fatigue. And these are just the main reported one, but the mechanism behind that is that there's a guaranteed thing that happens. And that is that it's going to reduce the amount of CoQ10. It's a very important enzyme that's vital for the energy production in mitochondria. And where do you need it the most? You need it in the organs that use the most energy, which is your liver, your heart, and your brain. Pretty important organs. This is all based on something called the mevalonate pathway. And you don't have to understand these words, but I just kind of put them in there so that you know that there's something going on. So HGMA-CoA reductase, that's an enzyme that's involved with producing mevalonic acid. And then there's a couple of intermediaries that are not important at all that leads up to something called farnesyl PP. And this in turn becomes squalene, which is a greasy substance that the body uses to make cholesterol. And then this same substance is also used to make CoQ10. So these two things compete for resources. But when you take a statin drug, now the statin acts on this enzyme and it inhibits it. So a chemical substance that interferes with something in the body is called a poison. And that's essentially what these things are. So by blocking this enzyme, you're stopping this entire pathway, and therefore your body is no longer able to make the same amounts of precursor for the cholesterol and the CoQ10. And if you watch that bigger, longer video that I made on cholesterol, you understand that cholesterol is not a stupid mistake. The body doesn't go through all this trouble to make something that's harmful. It makes the exact right proportions and amounts of LDL and HDL cholesterol of all the different sizes, depending on what's going on in the body, depending on what the needs are to repair inflammation and provide precursors to hormones and all these different things. It's a very fine-tuned mechanism. If you eat less cholesterol, your body makes more because it's an essential nutrient. Your brain is 60 to 70% fat, and 25% of that is cholesterol. Again, that's not a mistake. It's an essential nutrient. So when we interfere with the production of this enzyme, we're not just interfering with one essential nutrient called cholesterol, we're also shutting down energy production by interfering with the production of CoQ10. So now if we just go back to this list and we look at liver damage, muscle damage, heart, memory, concentration, depression, most of those is because the brain needs both cholesterol and CoQ10. It needs cholesterol as building products and precursors, and it needs CoQ10 to make energy. 95% of the energy in your body comes from the oxidation of fuel with the help of oxygen. And if you don't have the CoQ10, you're going to reduce that amount of energy production. And again, your brain, your heart, and your liver uses the most energy because they're the most metabolically active organs that you have. So when you interfere with the building materials and the energy production, now you get damage in all these vital organs, these essential organs that provide essential functions. But here's the thing to think about. Even if you don't have a side effect, even if you don't notice some symptom, are you better or worse off? If your body has to have something and you interfere with the production of it, are you better or worse off? You're worse off, of course. So what that means, and in terms of every medication virtually, because the mechanism is to interfere with a pathway in the body, with the metabolic function. And if the body is trying to do something, it's not by mistake. It's doing it on purpose. And by interfering with the mechanism, we are interfering with something the body feels is essential to do. And in every case, you're worse off. Whether you get a noticeable symptom or side effect or not, when you interfere with the body, when you reduce something that the body has to have, then you're worse off. So that's something to keep in mind. And of course, there is always a time and place for medication, but it's for life-saving, not for metabolic and lifestyle imbalances. The way to correct this, we talk about in length in the other video, but the main things to do is to get some exercise, to reduce sugar and carbohydrate and things that create inflammation and insulin. If you enjoy this sort of content, then make sure that you subscribe and hit that notification bell, and please share this information with as many people as you can, because there are tens of millions of people on these drugs that are developing liver and heart and brain problems as we speak. And if they can understand that they just need to shift their lifestyle just a tiny little bit in some cases and not really suffer, it's not about deprivation, it's just knowing the sound, the innate choices to make to improve those body functions naturally.